And with regards to the functionality today, we're going to be trying to keep things moving quickly throughout the program. We've got a lot to get, and so kindly ask everyone to post any questions that they may have in the chat function. So yeah, keep the microphones on mute, and as the panelists are going, please use the chat function to post any questions. As your moderator, I'll be monitoring that, and when we get to the Q&A parts of the program, there'll be two. I'll be collating the remarks and the questions that we've been gathering as we go. So please only use the chat feature for questions, and then we'll be going really smoothly like that. So I'll hand over now to Director Pippo with some opening remarks, and then we'll get on with the first panel. So Director, over to you, please.
So good morning, everyone. Thank you, Ian. I don't know if you can see me well, but I'll try to put me, yeah, okay. It's okay. Yeah, better. Well, again, good morning, everyone. And I would really like to thank you all for joining us today. We really are experiencing an extraordinary situation with global implications, and we are seeking the right solutions really to try to see if with multilateral actions we can really try to deal in the best way possible with the current let's say challenge we have to deal with. So in reality, COVID-19 has spread into every corner of our planet in just a few months, and affected societies in their health, economy, tourism, sports, culture, among many other areas in really an unprecedented way. And it is now when we truly recognize the vital role of science, technology, and innovation. The value of space programs has manifested greatly during this pandemic, and enabling contact tracing and identifying affected areas through disease modeling and transmission monitoring to remote work, telehealth, and communication, both for our businesses and also to stay close with our families and friends. And these are about some aspects of where space plays a critical role. At the United Nations Office for Outer Space Affairs, we therefore assign great importance to the availability of space benefits to everyone. While historically space activities were only affordable just for a few nations, access to space has changed dramatically in the last 10 years. But out of the 193 member states of the United Nations, only about 80 have ever had a satellite in orbit. We are still far from making the benefits of space universally available. It is high time that we ensure the space-based data and infrastructures are utilized to their maximum potential in all corners of the world. What exactly must be done? I would like to highlight three words: partnership, networking, and cooperation. UNOOSA has exemplified this approach exceptionally well in the past few decades. Thanks to the great support of our partners, we have been able to make a real difference in the world, bringing non-spacefaring nations into the space community, enabling students to turn their ideas into research, training individuals and teams to use satellites to save lives, and accelerate global efforts towards sustainable development as such. And building on the success of past health-related activities, we have been taking immediate steps to seek solutions and help the international community in addressing the COVID-19 crisis. A dedicated task force on Space4Health was established to improve inter-office coordination in developing concrete response to these new needs. And to help bridge the information crisis, UN Spider compiled examples of contributions and best practices using space in addressing COVID-19. This helps to facilitate the discovery of solutions already developed and used by global space stakeholders. Today's webinar is also an integral part of an overall effort to harness the power of space to tackle the challenges of humanity. And in tackling COVID-19, let's use space not only in the current phase, but also and mainly in the recovery phase. The world will need to restart, and satellites will certainly have their says in not only returning the status quo, but in shaping a more livable and safer planet. What we need right now to foster innovation in combating global challenges is diversity and integrated efforts. I'm therefore excited to have with us for this webinar a nice variety of speakers with different backgrounds.
Mute, Simonetta.
Sorry, Director. I think your microphone's just switched to mute. It's slight technical fault. If you could possibly just put your microphone on manually, then we'll get back up and running. And we lost just the last 20 seconds there. Thank you so much.
Yeah, Ian, but it was not me doing it, huh? So someone else did it. I didn't touch my microphone, so I'll try to read again the last part. I'm sorry.
Thank you so much.
I believe you lost from what we need right now is to foster innovations in combating global challenges as diversity and integrated efforts. I'm therefore excited to have with us for this webinar a nice variety of speakers with different backgrounds and stories. In the next hour or so, we are going to listen to different perspectives on the work that has been done by different stakeholders. We are going to delve into the specific role of UNOOSA as well as activities of the international space community. I'm really looking forward to your interventions, and I would like to thank you all for your contributions. And as we said, the three keywords are partnership, networking, and cooperation. And thank you very much.
Well, thank you, Director. So partnership, networking, and cooperation. Understood. And with that, I would like to move on to the next part of the webinar by just, well, first of all, congratulating everyone for keeping your microphones on mute. Could I also ask colleagues who are just joining in to also take their camera down because that will also help with the overall streamline of the event. The next part of the program is we're going to hand over to some USA colleagues from each of the sections inside UNOOSA to give their perspectives on how Space4Health and what Space4Health looks like from the different parts of the work that we do here at the UN Office for Outer Space Affairs. So I'll first hand over to Mr. Niklas Hedman, who will give some remarks from the intergovernmental process point of view. So Niklas, over to you. Thanks.
So, thank you. I hope you can hear me. Can you hear me?
Good. All good. Perfect. Thank you.
Excellent. I would like you to move to the last substantive slide of this presentation, please. So just scroll to the last slide. There. No. The one before, yes, thank you. So, dear all, thank you for having me making this presentation. This is a presentation that I have put up jointly with the chair of the working group of the Scientific and Technical Subcommittee of COPUS devoted to space and global health, Mr. Antoine Geisbiller of Switzerland. For your information, Mr. Geisbiller will make this presentation in the afternoon segment of this overall webinar. The reason I asked to scroll to the last slide is because the previous slides only aim to give an historical background and a background to the forming and establishment of the working group. And since the presentation will be uploaded on the website, there is no need to talk about that right now. So I will go really to the current achievements and state of affairs of the work of the working group. The working group started working last year in 2019, and its mandate is currently until 2022. Last year, at the session of SGSC, the working group really devoted its focus and attention on establishing a questionnaire that was communicated to all states members of the committee, to UN entities, and to permanent observers of the committee, and also, interestingly, to some other key organizations outside of the Kupus family, so to say, namely the Group on Earth Observations, the World Organization for Animal Health, the International Federation of Red Cross and Red Crescent Societies, and Doctors Without Borders, with the aim of gathering really a comprehensive picture of the state of affairs, how space technology tools and applications are being used to support global health. One of the aims of the working group is to analyze and define possible existing gaps in national, regional, and international capacities in using space science and technology and their applications for global health. So that has to be kept in mind all the time through the work of the working group. The questionnaire itself comprises 11 questions, and I'm not going to refer to all of them, but just in a nutshell to point to the essence of the questionnaire, and that is namely to look into what are the cooperative agreements and institutional arrangements and mechanisms, and I would say predominantly at the national level, between the health sector and other sectors directly involved in space activities. The questionnaire also focuses on means of capacity building, and I would say again really emphasize at the national level. That is very important to see how states are dealing with the interaction between the medical community, the space community, and other communities in fostering space tools for global health. So capacity building is very important in that regard. And therefore, we also ask about capacity building efforts being pursued. There is also questions relating to existing and planned mechanisms to better integrate space-derived data and information into decision-making processes. The last question of the questionnaire goes more into the technical field of space applications and tools, and the respondents are asked to provide an overview of existing and planned practices and initiatives in the current use of space, and that means standard technology, applications, practices, and initiatives in support of global health, and identify any gaps, if any, in the areas of telemedicine and telehealth, teleepidemiology and environmental health, space life sciences, disaster and health emergency management. So that is the background for the work of the working group at the most recent session in 2020 in February. The working group at the session of SGSC in February this year reviewed the responses received on the questionnaire, and I can inform you that on the website of the Office for Outer Space Affairs, you have a dedicated page, a web page, devoted to the working group with all documentation, all historical documentation, and all current documentation received at that session, including, of course, the extensive, I would say, quite comprehensive responses to the questionnaire. Unfortunately, for that particular session now this year, we did not receive that many responses, and that's why the working group is really encouraging further responses to the questionnaire leading up to the next session in 2021, and obviously also for 2022, because it was really assessed in the work of the working group this year that this questionnaire provides a very good picture and state of affair of how states and organizations are using space technology applications and tools in support of global health. On this slide, you will therefore see some of those considerations that were made at this year. it is very important to bring in the medical community into this overall coordination effort. And therefore, what was really one point made at the working group this year was that those who responded, those states who responded to the questionnaire, were all really identifying the positive side of having to reach out to the various communities, including the medical community. So in that sense, we have already achieved one of the ultimate goals of the working group, namely to really foster coordination and cooperation at all levels. I talked to the chair of the working group, and we are now planning to have a virtual meeting with the working group sometime in the coming weeks or in the coming month, where we will discuss lessons learned from the COVID-19 pandemic that we are suffering through right now, and see if this could be useful also for the work of the working group. So thank you very much for your attention.
Great. Thank you so much, Niklas, for that really useful remarks to give the overview of all of the dynamic activity that's happening on the intergovernmental side. That's brilliant. We have another speaker from UNOOSA now, looking from more of the technical side, from the space applications section. His name is Mr. Jorge del Rio Vera, and I would now like to hand the microphone over to you. So Jorge, off you go. Thanks.
Thank you very much, Ian. Thank you all for joining us today in this webinar that we have organized in the office. So I'm going to talk a little bit about space solutions for health. I would like to stress that space technology, data, and application is one of the many solutions that can be applied to understand and to tackle health issues, and it works much better in combination with others. It is true that we don't pay a lot of attention to the uses of space that we are doing in our daily lives. There is a big infrastructure that is behind and is in space. For instance, we are using a navigator in the car. We don't think that there are 4 constellations of satellites that are interoperable and compatible and are sending information to the little piece of equipment that we have in the car. But still, the data is coming from space, and that data is only part of the picture. What I said before is one of the many, and it's working better in combination with other things. For instance, in the navigator in the car, you have the signals coming from space, but they are integrated with maps that are generated on Earth, that are including traffic signals. So in this presentation, basically, I would like to make clear that technology is one of the solutions that you can use. It has advantages, has disadvantages, and despite of the intensive use that we make of space technologies every day, there is still potential to use these technologies more and better. Next slide, please. So I have organized a structure the presentation around some topics and issues that I would like to mention where space can contribute. One of them is fundamental research. So basic research is key to understand diseases. And you may wonder why space is related, why basic research on space is related to health. Well, in microgravity, there are very interesting possibilities. It offers very unique characteristics for this type of research. For instance, it's possible to grow proteins in space. And when you're growing a protein in space, it grows more in a 3D better order structure when it's in orbit, because it's not limited to a flat constrained by gravity plate here on Earth. And by getting these protein crystals growing better, you get more insights about the protein structure, which gives scientists additional information to see where they can target the new drug that they are developing, or to adapt the drugs that they have developed already to target particular elements in that protein. So space stations like the International Space Station or the upcoming Chinese space station are unique platforms for biological research, and there is a lot of biological research carried out in this platform. For example, in the office, we are offering opportunities to do microgravity research. There you have a couple of pictures. We have a cooperation with the China Manned Space Agency that is offering some slots to carry out experiments in the Chinese space station, the upcoming one. And two of the 6 experiments that were selected in the open call that we had about a year ago were related to biology. For instance, one of the titles was Tumors in Space Signatures or Early Mutational Events During Spaceflight Conditions on 3D Organized Cultures Derived from Intra-Individual Health Monoclonal Tissue. Or another one, Effect of Microgravity on the Growth and Biofilm Production of Disease-Causing Bacteria. So as you can see, I mean, there is a lot of research that you can carry out that can bring very useful information that can help expanding the knowledge that we have on some health and biological aspects. I mean, there are also experiments that can be carried out in shorter times, like in the top tower that we have a cooperation with SAM, the Center for Applied Space Technology and Microgravity, that is located in Bremen in Germany. And we offer these opportunities, and we receive proposals that are related to biology. So these proposals are helping to advance basic and fundamental research on health. Another issue is, I mean, you may wonder what happens with the astronauts that are going up there. Are there doctors coming with every crew that is going to the International Space Station? So the answer is no. It's no. And the International Space Station can teach us a lot about preparedness. It's very difficult to access. Normally, sometimes it happens, but normally there is no physician in the International Space Station. So in the event of a health problem, astronauts have to deal with the issue themselves, with assistance from ground. And the equipment that they have to be operated by themselves. Actually, not so long ago, there was an astronaut that had a blood clot in the neck, and that problem has to be dealt with the elements that they had on board. The key there is that the astronauts are receiving training, so they can deal with these problems, that many of the problems that they face during their stay up there in space. So the astronauts receive a basic medical training that is more or less equivalent to 6 hours of training related to medical skills. So they can get basic medical skills. They are also trained on the equipment that they have to operate. There are equipment in the International Space Station that can do ecography, for instance.
Okay, thanks, Jorge. You got 1 minute. Thanks a lot. Cheers.
Perfect. So I will run faster. So in the particular case of the blood clot, the astronaut was doing ultrasound on their own neck, and he was administering injections to himself. So space showed us how to mitigate the fact that maybe there is a physician not present, utilizing a combination of technologies of training, telemedicine, so with the support on the ground, and the use of remote equipment. Next slide, please. So it's also helping us to understand potential spread and how a disease spread, and it can help us in doing contact tracing. For instance, you heard about the GNSS, Global Navigation Satellite Systems, and it's not the only solution that can help you to do contact tracing, but it's one of the possible solutions that offers a very good accuracy. And the telephone operators and the data information operators like Google and Apple are utilizing that data. And you have a couple of graphs in the slide where you can see mobility data that is extracted from the Apple platform and from Google. And it's telling us how our habits have changed during lockdown situations. For instance, this is the situation of a country that was that was putting people under lockdown, and how the number of people that was moving around decreasing drastically, and how the behaviors on the graph on the right change. So it can help us to understand and to do policies and to see the effectiveness of the policies that we are doing by understanding mobility. There will be presentations of mobility later. Also, it helps us understanding environmental factors. So there is a lot of discussion going on about whether the temperature, the humidity can affect the spread of the disease or not. And for that, remote sensing satellites are very well placed for this. So they are the ones that can offer a lot of information on those issues. I mean, the last couple of things, I would like that you are taking a few key takeaways from this. Fundamental research is very important, and research conducted in microgravity can bring us to more light on biology. Space can teach us some lessons on telemedicine and preparedness. Space infrastructure is already supporting some of the activities going on disease spreading and helping understand environmental factors. Space is a tool of many others, but I hope that you will get an overview today of possible things that can be done. And of course, you can count on the office for support in identifying the best use that you can use for these tools. Thank you very much, and sorry for overrunning time.
Hey, no problem, no problem. There's a lot to cover, and you did a great job. And thanks a lot for your time. As you can see, the scope for using space applications in the current situation and to help countries understand and get a handle of it is obviously is huge. We're going to carry on with the specialists here and drill down into a little bit more of the details and hear from our UN Spider colleague, Shirish Ravan, talk a bit more about how space applications is in an emergency situation. So Shirish, over to you. Thank you.
Thank you, Ian. Hope you can hear me well.
Loud and clear.
Okay, good. So my two colleagues have already set the tone by mentioning what UNOOSA is doing for Space4Health currently. So one colleague talked about the Space4Health working group, and just now we saw some of the applications, space applications detailed by Mr. Jorge. What I would like to discuss here before I talk about UN Spider specifically, that in this COVID-19 situation, we all have seen surge in the use of geospatial information. Now, the most popular portal that I think everyone must be referring is from Johns Hopkins Institute, and you can see that portal is on ArcGIS. It's ArcGIS dashboard, one of the popular geospatial software, and it displays map and how the spread of virus is happening, which locations in each country, and that gives much better picture about the spread of our outbreak than just seeing the list. So that is the utility of geospatial information in these kind of situations. Now, one of the fundamental things when we say that geospatial information has been becoming popular during this particular crisis, it means there are a lot of tools being used for monitoring this particular situation, and geospatial technology and also space technology is at heart of these particular tools. And when I'm talking of these space technologies, I'm talking of use of Earth observation, global navigation satellite system, that is the location based information that is being collected to monitor the outbreak. We're also talking of weather monitoring satellites, how the impact of current lockdown is on the environment and climate change. There are lots of studies going on, and of course telecommunication. The telecommunication is very, very important these days because people are locked down and we are using best use of the internet and other networks currently, which we were not making so effective use in the past. So having said this, I would like to say that when we talk of use of space-based information in disaster management, and this particular situation is also disaster, because if you look at how the response is coming from several countries, that most countries have activated disaster management law currently, and disaster management authorities of the country are in the forefront. So they are the ones need to be really enabled with the skills for using geospatial and space-based technologies. And this is where UN Spider comes into picture. So what you see on the screen is UN Spider, which is United Nations platform for space-based information for disaster management and emergency response. We make sure that all countries use the space technologies effectively in the full disaster management cycle. So, and we have big network of regional support offices spread across all over the continents. And essentially, when we talk about disaster risk reduction or disaster management, we are also contributing in the mainstream objective of the United Nations, that is Sustainable Development Goals, specifically 11, 13, and 15, so directly. So what we are doing in order to enable countries, we are going from countries to countries, mostly developing countries, offering them technical advisory missions, capacity building programs, and during emergencies, we activate international mechanisms like International Charter or Copernicus or Sentinel-Asia. These are the mechanisms that provide the satellite images during the disasters. So when we go on, please, Patrick, can you go to second slide? So UN Spider is on forefront with the disaster management authorities, and disaster management authorities are on the forefront in the COVID-19 situation. So what we did, important thing is, if you can see this slide, on the UN Spider knowledge portal, we created a very special page. We call it coronavirus disease COVID-19 page. And if you go on this page is contributing to SDG 3, Sustainable Development Goal 3, and there are hundreds plus solutions that people have been offering for COVID-19 situation. They have been captured from different sources. So it's a one-stop hub, basically, that you can see how space and geospatial information is being used in COVID-19 situation. So I hope this page will be very, very useful to you. And without taking much time, I would like to also tell you one local experience. So currently I'm trapped in India. I could not travel back to Vienna. And in my city, the municipal corporation, or you can call it local government, has engaged a GIS-based firm that is using geospatial information and satellite data for demarcating the hotspots. So at that level, actually in the cities, they are identifying the hotspots, they are identifying the crowded spots, and they are demarcating the areas into different zones. And that's how on daily basis, they are using GIS information basically to control the outbreak. And the last point of my presentation is that during crisis situations like this, you can't teach people to use the technologies. And this is what UN Spider has been doing. We have been going from countries to countries and enabling disaster management agencies to use these tools on technologies on regular basis, so that during the crisis, they can use that effectively. And I think that is the most important contribution UNOOSA is doing through the UN Spider program to this COVID-19 situation currently. So thank you so much.
Hey. Thank you, Shirish. That's really great. I mean, as you can see, UNOOSA is doing a lot through UN Spider, and the portal, as you said right at the very start of your presentation, is the traffic going towards that angle is really high.
Thank you.
So thank you, Shirish, for your time. So we're now moving on to the first panel discussion. We've collected a really interesting group of experts from different stakeholders, different parts of the world, who are going to start unpacking a little bit more about what we're talking about today. I do note, just going through the participations list, which is hovering around 130, 140, so I may have missed it. But our first panelists, who are Miss Anna Laura Di Federico and Miss Lucia Luzietti, I don't see them at the moment in the participation list.
No, I'm joining. Sorry, I'm joining. I'm Lucia Luzietti.
Perfect. Welcome, Lucia. Okay, so just before I hand the microphone over to you, I'll just encourage all colleagues and participants joining that now is the time to get engaged in the chat section. And as the panelists are presenting, please do use that to pose questions. I'll be monitoring the chat and collating those questions. We're going to have a Q&A after all of the panelists have presented. So panelists, please do watch the time and move forward nice and smoothly, and hopefully we get a lot of time for some dynamic exchanges at the end. So please, Lucia, over to you. Thank you.
Okay, thank you for giving us this opportunity. I would like to show you in this short session some products that we provided for the Copernicus EMS Rapid Mapping Service. You know that the European Copernicus service provides geoinformation products, maps basically, based on satellite images, to support civil protection and humanitarian aid operators in their tasks related to prevention, preparedness, and reaction to natural and man-made disaster. This is the main focus of the service, and especially for the rapid mapping service, the task is to provide information based on satellite images during an emergency. So it is a 24/7 service. Please go on. Okay, we worked for the Copernicus EMS Rapid Mapping also in support of the coronavirus emergency. And I will show two examples that we provided in the last 2 months to the user. Let me start with this one. This is a product requested by the Italian Civil Protection when they started to work on the plan of the phase 2, so after the lockdown. So basically, we provided detailed cartographic product based on satellite images in order to give an updated view of city and its evolution in a short time. With this product, the user has the opportunity to work with the product in order to have accurate measurement of open, for example, open or closed space for the identification of the maximum capacity of spaces dedicated to public services or to other services. And this kind of product are relevant because the user have the opportunity to integrate the cartographic products with additional national geographic layers to plan correctly the activities. For example, adding information concerning the census of the census section, in which it's possible to estimate the present population combined with its composition in terms of gender, age, all relevant information, or to have a view of a road graph to the transport network to understand where are the services infrastructure, public and private, and so. Please go on. So in this case, over Torino, we basically identified for the Italian Civil Protection the mobile and the temporary hospital infrastructure. In this way, the user had the opportunity to have a continuous census of installed infrastructure. We provided a detailed information of opening of street markets and green areas because during the lockdown, all these places were completely closed. And in order to plan correctly the phase 2, we used the satellite images to provide a detailed cartographic product useful to understand where are the access points, which are the usable area, and again, the merge with additional information can help to understand the maximum people density accepted versus the limits defined by the law for this phase 2. Please go on. This is another example of application during the phase 1. So in this case, during the lockdown, because the lockdown in force within several European countries generated important traffic key at the border areas. For this reason, the European Commission decided to use the Copernicus contributing mission, so the satellite data, to monitor every day the traffic jam and the number of trucks versus the number of vehicles in the jam. So during the lockdown, we used satellite images to extract this kind of information every day, provided in a very short time detailed information in a simple report. This kind of information was extracted by very high resolution optical data, but we performed some tests in order to provide this information also in case of cloud cover or 2 times per day. And for this reason, we decided to use in some cases also SAR data that are very useful because allow to extract the similar information also during the evening when there is the second SAR satellite pass. Please go on. This is a completely different production that we provided several years ago, just to give you an idea of the application and how a rapid mapping service such as the Copernicus EMS can be flexible using satellite images. So this is a production that we delivered for the Ebola epidemic in Guinea in 2014. So in this case, the user requested to identify inside very large area of interest the palms cultivation, because the main vectors of the virus were bats, which dwell on oil palms. For this reason, epidemiologists seek to identify the area of oil palm cultivation in order to locate areas where potential patients might be. So for this reason, we used the satellite images. We worked with optical data again to provide the area where were located the palms, the oil palms. And the user, again, can use this product to check where are located the villages with the integration of additional information such as the density population and so on. Please go on. For the same crisis, so again for the Ebola crisis, in the same year but some months later, we supported also the Belgian Civil Protection because they were planning to send a medical mission to Guinea to support the country during the crisis. So in this case, the aim of the rapid mapping product was to map all the infrastructure and the facility inside the area of interest identified for the medical mission. So we provided in a short time very detailed reference product in which we focus. No, please go on. Sorry, I don't know why. No, please. The the previous, okay. For this reason, we worked on the tailored reference product in which we reported the road and hydrological network to know in advance any limitation in moving people and or goods, the location of human settlement, and the identification of building use. This is another very important information when the user need to plan a medical mission because they have the opportunity to map resources already available on the territory and the location of the airport. Okay, please go on. This is another application for that we provided for the phytosanitary emergency in Italy. This is a product that we finalized in 2015, so several years ago. But again, to give an example of the different application that the user can ask to the service. Indeed, in this case, we provided in a short time a detailed analysis of the status of the agriculture because a couple of regions in Italy were affected by the Xylella bacterium, and so in order to manage the emergency, a special task force was defined and emergency plan foreseeing the eradication of all the plants potentially affected by the infection in order to create a phytosanitary barrier to stop this expansion. The focus of the product based on very high resolution optical data was the extraction of information concerning, for example, olive tree, eradicated olive tree, eradicated fruit tree. So all the activities ongoing in the field in order to fight the spread of these bacteria. This is the last slide with of this presentation. Thank you for your attention.
And thank you, Lucia, for a really, really interesting presentation where you managed to open up and unpack the issue in a practical sense. And I was keeping an eye on the chat, and it was certainly being very well received by our participants. So thank you. And I do encourage colleagues who want to reach out to Lucia either during this session or afterwards to indicate such. So now moving on to our next speaker, we're going to be going from Europe to Southeast Asia. I'd like to hand the microphone over to Mr. Abhineet Jain from Maxar in Singapore, who's going to be talking about imagery and Earth intelligence, again, for crisis response. So Abhineet, over to you, please. Thanks.
Greetings to all from the lockdown Singapore. I hope you can hear me well. All right, Ian, can you go to the next slide, please? Thank you. Well, Maxar is a leading space infrastructure and Earth intelligence company. We are responsible for providing operational support to nearly 92 on-orbit operating communication satellites worldwide. A large portion of these communication satellites provide critical communications to national governments, state and local first responders, and television and radio networks. Now, with the physical distancing and work from home a new norm, I guess telemedicine and teleworking is one of the unique applications of space communication for the societal benefit. In addition to communication satellites, we currently have 4 operational very high resolution imaging satellites in the 30 centimeter to 50 centimeter class. You'll see from the chart here a list of satellites from the past, current, and interestingly, in the future, we are building our next generation 30 centimeter class imaging satellite constellation called as Worldview Legion, which will dramatically expand our ability to collect the world's highest resolution satellite imagery starting from 2021. And we are working on a possibility of collecting nearly 5 million square kilometer of the Earth every day, with possibility of collecting up to 15 times collection in a single day. So imagine today, our ability is limited to watching actions on the Earth practically on a daily basis with all these high resolution assets in space. But going forward, if we could do this nearly 15 times in a day, imagine the potential that we can explore of these space technologies. Now, the current pandemic has highlighted the value of global transparency like never before. Currently, as the pandemic is unfolding, various governments are trying to find different types of information for taking decisions to organize various types of activities. Now, as part of Maxar's initiatives, Maxar's News Bureau initiative support news reporting efforts around the world, documenting significant events happening globally. For example, rapid construction of hospitals in Wuhan, China, to address the emergency in Wuhan, the quarantine of Diamond Princess cruise ship in Japan, and the dramatic drop in activity in transportation centers, businesses, and public spaces around the world as the pandemic grows around the world. Could we move to the second slide, please? From the space application standpoint, there have been various studies in the past investigating environmental links to the outbreaks of infectious diseases. However, the current COVID situation is very challenging, and it's difficult to foresee outbreaks of new viruses like COVID-19 that are thought to transmit through wild meat or animal trading. But for pathogens transmitted through environmental routes or that have environmental connections, satellites have been powerful, and various studies have been done in the past. Given the current situation, how very high resolution satellite imaging can help answer some important questions. For example, where are the remote populations? How do we reach to them? How quickly are populations growing? Where are internally displaced persons and refugees? Just on these, to give you an example, we started digitizing entire African continent using automated tools and the images that we have been collecting over the African continent in the last couple of years. And within 3 months' time, we have nearly ramped up mapping every individual household in the continent of Africa and added the road transportation layer. And this is the power of artificial intelligence, automation, and remote sensing at scale, given that the pandemic is touching nearly 184 countries as of now. So there are many other areas where satellite imaging can be used to respond to the emergencies. Can we move on to the next slide, please? Now, as the coronavirus pandemic surges, many governments are working, and as an example, our team in Tampa, Florida, created a Insight Spotlight report that used satellite imagery, country-scale human landscape datasets, and some tools like crowdsourcing to assess where and how the coronavirus spread is happening in Iran. And given Iran's porous borders, large transient population, and smuggling network, the outflow of infected persons is likely far greater than presently known. So the spotlight highlights the severity of scale of the coronavirus in Iran, as well as the government's inability to handle such an outbreak. It also discusses how poor transparency and issues with regional migration compounds the global impact on the coronavirus spread. For this particular example, satellite imagery was captured and analyzed over 2 cities in Iran, reeling from the coronavirus infection, combined with human landscape data set at the national scale and using GeoHive as the crowdsourcing platform. We created a timeline of events that illustrated where and how the virus is spreading in Iran. So you could use the link on the slide here to go and read more. Currently, we have this human landscape data set, which is a multi-layered human GIS data set, including critical information like demographic details and other interesting features there, created for nearly 60 countries in the world. Can we go to my last slide, please? In the interest of public-private participation, every time when crisis like this occurs, we are committed to supporting the humanitarian community by providing critical and actionable information to assist response efforts and fulfilling our own purpose of seeing a better world. So as part of our open data program, Maxar is publicly releasing data of the affected areas to support disaster response as it becomes available. As of now, we have released nearly 19 cities imagery in African cities. I would not go through the names of the cities. You can use the link provided here in the slide to see the details. But this request came from humanitarian partners that we work closely with, like UN Spider and UNOOSA. And as part of this activation, I also want to extend that we will accept requests for additional city releases should it be required. And we are also looking to the community to guide us as to where the greatest needs are and where our imagery can directly support the humanitarian response. So for anyone who uses the imagery to create derived data or information, please let us know. If you would like to contribute that back to the community along with the source imagery, any partner who is looking to share data can contact opendata@maxar.com or contact us on Twitter @Maxar handle. So please stay in touch. Let us know how we can contribute by providing you some of these resources that we have that may support your work and your mission at this critical time. This is the end of my presentation. I hand over back to Ian. Thank you very much.
And thank you, Abhineet. That was really interesting. You couldn't have said it better in terms of the power of space combined with artificial intelligence and other new technologies to really make decisions at scale. And that's exactly what we need in the current crisis. So I'm going to hand over to our next speaker, and can I just say thanks again to the speakers so far for keeping within the 7 minutes. We have Mr. Giriraj Amernath from the International Water Management Institute in Sri Lanka, and he's going to be drilling down a little bit into how we can use Earth observation in an agricultural and food security sense. So please, over to you. Thank you.
Thanks, Ian. Am I audible?
Yep, loud and clear. Thank you.
Yeah, thank you so much. And thanks for UNOOSA for giving this opportunity, and congratulating all the speakers who have shown tremendous example of what we could do during the lockdown, and some of the technologies have been presented by the experts. Today, I will speak more on linking the two aspects of food security and water risk in a very brief, but more we could discuss and collaborate as we move on. This particular slide is a map showing one of the highly used maps in global donors across the world. We have prepared a map called Global Cropland Harvesting Areas. So this is very much important because during the lockdown, many of the rural landscape or the farmers who are ready to harvest the crop, if there is a lockdown, how do they harvest? If they keep it for a long time, there can be a likely unseasonal rainfall or a disease that could able to wipe out the crops that are ready for harvest. It will have a lot of economic crisis at a national level, but more than that, it will have local scale food security, the challenges around this process. So this particular product was looked at in early April and provided several countries on if you relax the policies in lockdown for rural farmers, what you could better do in terms of the harvest. And the policies have been adopted by several countries, show positive signals in the remote sensing, which I will present in the following slide. So can I go to the next slide? So to move further on that, we are member of CJR, Consultative Group of International Agriculture Research. Over the last 2 months, we looked at what better we could strategize ourselves on integrating COVID and agriculture climate risk management. Many of the speakers have touched upon innovations in space technology. And what we have seen is that it can be a good vehicle to understand the bridging gap between the end users and the challenges that the COVID is running through across several nations. What it clearly came out is the impact on agriculture and its supply chain, which you are all, even in your communities, you would have passed through that problems. Increasingly, we have seen several countries are looking at dual challenges of managing the climate disasters with the COVID, where we can see number of evidences are already happening, and countries are struggling to manage this both dual nature of the problem. I've briefly spoken about the food security challenge, and if the lockdown has opened up, how we could meet the water demand for the farmers who are irrigating the crop. So that's where again we have run a lot of hydrological model to look at water supply and water demand analysis. And if there is a increasing risk of flood or cyclones or any other natural disaster happening, it will likely to have a lot more waterborne diseases, which I will touch upon in the following slide. And climate safety net is very important when we look at the rural landscape. This is very important to look at by the member states of how they could do safety protections in the rural systems in regard to agriculture. So what we have come up with a new program of what we can do in the market-driven food system, coming up with health. It's not just about human health. There are problems related to livestock, the ecosystems, where there are a lot of positive news in pollutions. There is also inclusive public program. Many countries are opening up a lot of welfare program to meet the safeguarding the rural landscape, the migrant farmers, and last but not least on coming up with COVID as a challenge, but it is also an opportunity of what we could do, more new investments, proactive policies that can enable them. The next slide. So as I was speaking about the global crop harvest, satellite data is one of the critical data in my opinion, where you can see the two time series images that are showing a crop that was harvested in less than 2 weeks of time. Nearly about 70 million hectares of crops in India has been harvested in less than 2 weeks of time. And again, we could daily track this satellite data and find out what are the areas where the crop is still left, what are the areas where the policies have still not been reached to the rural landscape. You could do number of interpretation of this analysis and reach out to the government how better we can do. And yes, the crop has been harvested, and what we need to do now is to look at can we customize and provide more targeted farmers climate information to the farmers in the coming months, preparing their land, knowing them what crops to be cultivated, and also protect the farmers through insurance, and also ensure that if there is a timely harvest is done. And the second thing, we are also requesting, understanding this crop monitoring, we could also provide a timely access to the financial instruments as well. Without having any access to finance, it's not possible to talk about food security. And it is also important to focus on high frequency monitoring, like somebody have spoken about daily monitoring of satellite data. These are very important. And also to, as we are talking about social distancing, we need to look at more digitally enabled insurance mechanisms, looking at market pricing. A lot of ICT based systems can be provided to the farmers to provide where the right pricing you could do, how the value chain companies could able to reach out to the farmers to procure the goods. Otherwise, some of the perishable items will all get lost. And last but not least, in the food security arena, we have to look at this improving the family nutrition through the welfare system. several countries are providing dry rations and providing a right kind of a nutrition supplement. Otherwise, because there is no income to them and we need to take care of at this difficult time, improving their nutrition focus is also an important priority in the policy response strategy. My next slide is also to look at, as we look at agriculture is one part, there is another sector of important is the disaster risk reduction. On the top slide, you will see that several developing countries, including developed countries, will focus on, in the coming months, the incidence of more flood, which is very common in our part of the region where we live in South Asia. And the bottom map shows the spread of COVID cases. So though we don't see a large numbers in South Asia in terms of the number of people dead, but the cases are increasing, and there is already forecasted that during the monsoon, June, July and August, the COVID cases are going to go more and more. So what we need to do is some of our recommendations we put forward is to look at what are the multiple hazards that are happening in your country. Can we look at managing both the COVID hotspots and overlaying with the climate hazard, so that the disaster management agencies, as discussed by Dr. Shirish, looked at what are the preparedness strategies we can do, and identifying the hospitals where there is already COVID cases are there. Can we move them to the social distancing in regard to taking them in schools and colleges, so that better safety strategies can be done. And also not to forget about the elderly people living in the rural landscape. How do we evacuate them better given their combination of both COVID as well as the climate disaster? My last point is about, as both previous speakers have spoken about the rapid response mapping, it is important to activate timely. It's not about having some access to images, it's about the timely reaching the data, ensuring that the data is well utilized by all the sectors, whether it is hospital or disaster sector or the water sector, talks about water sanitation and other. So there are a lot of challenges which are exist in this in the coming months. So preparedness is very important. We'll look at the whole phases of disaster management. So I would request all the participants to read the links that are available here, the guidelines we prepared, the steps in which how governments can cope with the disaster risk management. And again, look forward to have more interaction as we go forward. And thank you for giving this opportunity.
And thank you, Giriraj. That was yeah, a really fantastic and nicely structured dissection of the situation there and the work that your institution are doing. And I think there's a lot of examples in there which I think from some of the colleagues watching will be thinking, okay, there's some lessons to be learned that I can take back into my own context. So thank you for sharing your experiences. We're now going to jump to Europe and the European Commission. Our next speaker is Ms. Astrid-Christina, who's actually working from the Copernicus Services Initiative for COVID-19. So she's going to talk about a little bit about what this looks like as a provider of such fantastic information that's helping save lives and support policy making around the world. So Ms. Astrid-Christina, over to you, please. Thank you.
Thank you very much for having me. Thank you for organizing this webinar. So I'm Astrid Koch. I'm representing the European Commission. We are the program manager of the Copernicus program. So Copernicus data and services are free, full, and openly available for everyone to use. So the products which are currently describing will be available and usable for everyone. So this is just a short presentation on the operational products developed by the Copernicus Atmosphere Monitoring Service CAMS and the Copernicus Climate Change Service C3S for making informed decision. They are implemented by our partner, the European Center for Medium Range Weather Forecast, ECMWF. So next slide, please. So CAMS is monitoring our air quality in Europe using the Copernicus Central satellites, ground-based operations and advanced numerical models. And due to the COVID crisis, there's increased interest in air quality. And the air quality is partly determined by the emission of the pollutants. And we have set up with our partners at ECMWF a recent visual products like what will be today's forecast for the NO2 column and the particulate matters under normal conditions on the right. Then you see what will be under the current restriction measures in the middle, and then you see the difference between the two. So they are available on the website, and there's a dedicated EU Space webpage on what we are doing, not only what we're doing, but all our partners on the top of the page. So you're invited to look at that. We are constantly improving what we deliver. So there is a daily COVID-19 emission scenario run available to you, and also if you want to play with the data, the air control toolbox. So, and next slide, please. So here you see on top the dedicated page for the atmosphere monitoring service, where you can access all these tools. So there are a lot of visual tools and animations available. There you see the latest situation in Europe. Then you can see the forecast model estimates of the reduction of air pollution on a daily basis, including making sure that it's included the weather effects. And then for longer time series, you can see trends. And I'm talking now about the top, this graph on the top right is when you compare the means to the reanalysis. So you see the red line there is the daily average, and then the dotted line is the mean for every 7 days. That compares to the reanalysis done for 2017 to 19. These are the ranges in gray. And then you can look at how consistent the surface and the satellite measurements are by looking by comparing the data from the satellite, like from Sentinel-5P to POMI, with surface measurements. And then you have a good idea about the trends. CAMS is also currently contributing to a number of epidemiological, sorry about that, studies, trying to evaluate the links between air pollution and COVID-19. So next slide, please. Here you see some examples of Europe and the United States about the measurements of Sentinel-5P, TROPOMI, on the NO2 total column from mid-March 2019 to March to April 2020. You clearly see a reduction of emissions there. But I have to say we need to be careful with what comes out, because if you're not using the data correctly, then you have a different outcome. Below you see the two on the left and the two images on the right. What you do if you make sure that you use the appropriate filter. If you have acquisitions which have clouds, you're not measuring the NO2 below the clouds. So that needs to be filtered out, and you can come up with two different results. So it's important to stress that. So next slide. So from the Copernicus Climate Change Service, this service helps health experts to explore how temperature and humidity affects the virus spread. So we teamed up with software experts to develop an application to map mortality with temperature and humidity data. And that application is also improved. They will be working with the atmosphere monitoring survey to work closely together to add some new layers into the app to include NO2 and PM10. So that is getting better by the day. And this has actually been done to provide the health community with the tools required to analyze existing claims that links between the pollution and the COVID-19 outbreak. So I was told I have to make this short. So this is the end of my presentation. Thank you very much for listening. Bye.
Thank you so much, Astrid. Yeah, what a fantastic overview of the work that the European Commission is doing there with the Copernicus program. Such a high-profile contribution to these global efforts. So thank you for taking the time to run that through. There's one question coming your way at the end, so please do stick around. So our final speaker for this first session is Mr. Aravind Ravichandran from PricewaterhouseCoopers. He'll be moving us along a little bit in the process, so away from the generation of the data itself and actually looking at how that data is shifting into the policymaking arena. So a really interesting topic, I think, for a lot of people on the call today. So, sir, please, over to you. Thank you.
Hi, good morning. Can you hear me all right?
Loud and clear. Thanks a lot.
Brilliant. So my name is Aravind. I'm a senior consultant at PricewaterhouseCoopers here in France, and thank you for the opportunity today. So if you can go on to the next slide. So today I just wanted to quickly touch upon three topics, slightly a continuation of what the other speakers talked about, and also moving on to different applications and different satellite data that we can get, or different types of data that we can get. Just a quick definition so that we're all on the same page. You know, obviously there's a lot of data that we can get from satellites that people have talked about and people continue to speak about. It's also interesting to remember that you can combine this satellite data with other sources of data and then data fusion techniques in order to derive fresh insights, and that's going to be key for us to use satellite data in the future. First, I'm going to talk about crisis management, how we're going to use satellite data during the crisis. And second, how we can use satellite data to find the impact of the crisis from an economic perspective. There are various applications. I'm just going to go into one. And third, how we can use data from satellites to, to set policies for the recovery. So if you can go on to the next slide, please. Yeah, thanks. So for managing the crisis, I think a lot of the countries are coming out of the crisis, but there are a bunch of countries where the crisis is continuing to develop and where contact tracing is also very hard to do. What satellite data can do here is to help us identify areas, hotspots. I think other speakers also referred to that using satellite imagery. So we have places, for example, this is a population density map that was created by a global human settlement layer. That's also from part of the European Commission. So here you can see from the map that there is parts of the city which are of very high population density. And for an epidemic such as COVID-19, population density plays a crucial role. So what satellite data can do, in these developing countries where data about population density is not readily available, you can use satellite data and artificial intelligence based algorithms to identify, even inside, the city Kano in Nigeria. You can see that in this location, which you can see as red and orange on the map, you still have a segregation between spots, which are, upper class neighborhood, and then there are also spots which are urban slums with very high population density. So if you're a government trying to, conduct tests or in the future distribute vaccines, satellite data is very important, especially very high resolution satellite data. In this case, it's 50 centimeter, but as colleagues in Maxar said, there is also 30 centimeters. So satellite data can really help in segregating, within a city limit, which street to take for, for officials to go and conduct tests. So satellite data is very crucial for crisis management from that aspect. And going on to the next slide, please. Here, I wanted to focus on impact of COVID-19, and one of the ways that it has affected the economy is through the aviation industry. There are a lot of things, a lot of industries that you can find an impact, economic impact due to the COVID. Here I've taken an example of aviation. So what you see here are two maps that's generated by a company called Flight Radar 24, which basically just crowdsources signals that's coming on from the aircrafts. So ADS-B that you see there, Automatic Dependent Surveillance Broadcast, is a signal that's periodically coming out from aircrafts as they are on air. And these are periodically coming out to just show their location for people to track where they are. And you can see that this on the left that you see for February, on the right you see for March, the number of flights that people are taking has drastically gone down, as you might imagine. And with satellite data, what you can do is you can get this data and combine that with market data, pricing figures, number of aircraft that have not taken off, pricing trends and market data, so that governments can now understand what is the potential economic impact that is on the aviation industry. There's also a lot of news coming out about, aviation industry is hit with, X billion and X billion revenues due to the COVID. So satellite data combined with official data that's coming from their aircraft companies can help governments and also global economies understand what is the impact of satellite, the COVID-19 on the economy. On the next slide, please. And this slide, I wanted to move on to the recovery phase. So 3 different topics in a way, so that people in the audience can get an understanding of what else satellite data can do. So here I want to come back to mobility. I think one of the speakers mentioned before. So this is the mobility data that Google has made freely available. And this is, primarily an indirect service that's available thanks to navigation satellites. So you can see that this is just an example from France, that people are not going to retail shops, parks, and metro stations anymore. And what governments can do with this data as they are easing lockdown measures is, on the right, you see Earth observation data, very high resolution Earth observation data. So you can monitor parking lots, counting number of cars on the street, and correlate that with navigation data. So you can see that, okay, in the next week, people are going to the transit stations a little bit more, and also starting to go into malls a little bit more, and you can correlate that with Earth observation data by checking if that's online. And these 2 sources of data can be an input for people who, for governments especially, who want to set policies, because lockdown measure, as you would imagine, needs to be very data driven, and satellite data once again can play a quick part, especially when you combine different sources of data to feed into the policy making decision. Again, satellite data is going to play a key role there. So these are 3 applications that I wanted to just talk about, so that there's an expansion. It's not only Earth observation, there is navigation satellites, there is AI that's going to help in both in impact assessment, also in recovery of the economy from the global crisis. So that's it from me. Thank you very much.
And thank you, Aravind. That really was quite impressive stuff. And I think it's really useful for people to kind of see all those different examples of policymaking in action, and policymaking augmented by the power of space, which I think is pretty much at the heart of why we're still hovering well over 120 colleagues tuning in. So I think we're now moving on to the Q&A session. I've been watching the questions, and the first one is going to go to Astrid Koch, and it was from a listener who asked for COVID-19 emissions. So I think somebody picked up a comment with regards to COVID-19 emissions in your presentation, and if you could just give us a little bit more details unpacking that. And then just a second question, and this is to open to anybody, and that was another one coming in from the chat that said, how is Earth observation being used to support infrastructure development, specifically looking at access or increasing access to isolated villages from a health perspective? So for that second question, could I ask any panelists who are interested in taking it just to indicate their name in the chat, and then I'll hand over to you after Astrid's finished. So Astrid, over to you. So unpacking COVID-19 emissions. Thank you.
Yes, thank you. The COVID-19 itself is not doing any emissions, but what I was referring to is the difference of emissions under normal conditions. Normal means, without the COVID before, and the emissions after the restrictions put in place. That was it. Thanks.
Perfect. Thank you so much. So hopefully that has answered the question. So with regards to the second one, Earth observation and supporting infrastructure development in terms of supporting access to isolated urban areas. Do I have any volunteers, please? Well, I think I know that our UN Spider colleagues may have something to say about this as well. So I'll just keep talking to see if anybody does want to chime in. It's always hard to know exactly where everybody is. Okay. Oh, there you go.
Yeah. Okay, so the question is about urban infrastructure, right?
Question is about analyzing infrastructure for non-urban settlements and how Earth observation can be used to support and increase access to such isolated dwellings. Thanks.
I think if we just recall presentation from IWMI, Mr. Giriraj Amernath, I think his entire presentation focused on non-urban infrastructure. I would say here the most important infrastructure that we are talking about is agriculture, because food security is the most important concern that everybody has post-COVID-19 situation. And I think satellite data has proven enormous potential in terms of its usefulness in ensuring the food security by monitoring agriculture and rural development. So I think if we just recall his presentation, I think we will get a lot of pointers to how satellites can be useful in non-urban infrastructure. Thank you.
Perfect. Thank you so much. And another good chance to remind everyone that all the presentations will be made online. I see Abhineet thing to add to that response. So please, over to you.
Just a quick addition, going back to the example that I mentioned in Africa. I think the intent there was to know where the population is, the extent of the inhabitation there, and the communication in terms of the road infrastructure, etc. So mapping all these features to create a very enriched map would definitely go towards answering the question. Same goes in terms of in rural context, where the agriculture is happening and how the food produced there is transported. So mapping the supply and demand side, where the food is being produced and where the demand is, and the connection, the communication, infrastructure communication in between. So satellite imaging and mapping and all these new automated tools and technologies are evolving and emerging to deal with this question at scale.
Perfect. Thank you very much for that. Okay, moving on. We've had three more questions come in, and I'm going to draw a line there because we do have a second panel coming. So the first, I'll read all three out, and then we'll take them one by one. So the first is coming from Mr. Bob Bell, EMS rapid mapping services for COVID-19. How is that specifically being used to support the pandemic response in developing countries? So that's the first one. And I think perhaps our Copernicus colleagues could have picked up on it. I'll do the other two as well. And again, if any panelists are interested in volunteering, please do indicate in the chat. So the second question is what ways Earth observation is helping countries meet their human rights obligations, for example, air pollution and the right to a healthy environment. If anybody wants to take that one on, please indicate such. And then the final one is looking at how, or it's more of a hypothetical in that there's been talk about the virus loving the cold, and has there been any use to the panelists' knowledge of space being used to look into that theory and the correlation between heat and humanity? So I'll jump back to the first one. So has EMS rapid mapping been used, and how is it being used specifically for developing countries? I see Lucia wanting to take the floor, so please, Lucia, over to you. Thanks.
Yes, thank you for this question. Let me recall that the Copernicus EMS Rapid Mapping Service provide information when there is a specific request from the user. Okay, so we react when we receive a request from the user. And at the moment, for the COVID emergency, we provided information only inside Europe. Okay, so we didn't collect a specific request from developing country. Okay, so it is the service run in this way. So we need to collect a request to provide information.
Got you. Thanks a lot for that. Anybody else on that particular question?
Hello, hi, here's Astrid. I want to say that the Copernicus Emergency Management Service can be activated only by dedicated users. These are usually a European Union emergency management officials in dedicated agencies, and outside Europe, the EU delegation can activate the service in cooperation with our emergency response center, and there will be evaluation whether the activation will be done. So, but that's done by the colleagues from DG ECHO. Thank you.
Perfect. Thank you so much. Okay, moving on. Anybody interested from our panelists with regards to the human rights question and unpacking this of a very important angle in terms of how space can support member states in meeting these obligations? I'm just going to leave the floor open, see if anyone jumps in.
In an example, Abhineet here. An example comes to mind during the Myanmar refugee migration. United Nations, several organizations and Maxar worked to understand what was the scale of the migration. Nearly reading from the news reports, it was impossible to understand what the governments were declaring. But space provided that transparency that is needed, and actually mapping nearly 1 million or more migration coming from Myanmar into Bangladesh, India. And so knowing firsthand how these migrations are happening across the border, in what state, what resources, and what services do you need to provide in order to keep your human rights obligation. So I'm sure space technologies and Earth observation and all the tools that we are talking about are, they have a lot to offer in terms of understanding the situational awareness and responding rightfully to meet the right, the human rights obligation.
Thank you very much for that. And yeah, it's a big challenge for sure. So yeah, really useful stuff. Last question: the heat-humidity link, and if space is being used to kind of shed a little bit of light on this theory. Anybody got anything in their toolbox that would be able to help this very interesting question coming in from the audience?
Hello, here's Astrid. I would like to say that there is a Health Community of Practice, a telephone conference every week, currently dedicated on COVID-19. It's usually on Thursdays. Please go on the website, and there are dedicated sessions, and the upcoming session will be on heat and humidity, and there's another session on wildfires for the heat. So I'm not the matter expert here, but there will be a lot of discussion, so feel free to join. Thank you.
Thank you. So I suppose we should be really getting through the program now. So if we were in a normal setting, this is where we would then erupt into polite applause for all of our first panelists to thank them sincerely for the time and the expertise and the insights that they've shared. So I'll do it on behalf of everyone. So thank you, all of you, for joining us today. There's been quite a lot of activity over on the chat, and certainly a lot of appreciation being expressed for both the work that you're doing and the contributions that you're all making in your own perspectives. So thank you, and please do keep in touch. So now it's my pleasure to move on to the second half of the program, where we're really going to be looking at health itself, and how space can be used in lots of different contexts from a health perspective. As the Secretary General himself said, at the midst of the COVID-19, it's the time for solidarity and for science. And obviously space is all about science. And we're going to now be looking at how space is supporting both the science and the practice of healthcare. So our first speaker for the second session is Ms. Astrid-Christina Gallego-Rose, founder and CEO of Diphthon UG. And she's going to be looking specifically with regards to mosquito risk areas. So please, Anna, over to you. Thank you.
Hello, good morning, ladies and gentlemen. First of all, I would like to thank UNOOSA for the invitation. It's a pleasure and an honor. My name is Astrid-Christina Rosa. I'm founder and CEO of Diphthon. Diphthon is a startup which develops an application for detecting Aedes mosquito risky areas based on artificial intelligence that combines satellite data and ground data. The project started in 2015, and after winning 3 competitions, we incubated at the European Space Agency, and recently we were selected to the PARSEC Accelerator Program. Our team is composed by epidemiologists, geoinformatic engineer, developer, and myself. I'm a lawyer and responsible for the business development. We have our recent partner, Visiona, a Brazilian space company specialized in the design and development of satellite applications. We are based in Darmstadt, Germany. Next slide, please. Aedes mosquito is responsible to transmit dengue, Zika, and chikungunya. At present, more than 50 million of people are infected per year, and it is responsible for 40% of the disease on the globe. Governments spend a lot of money to remediate the problem. At present, vaccine has not proven a good result. I'd like to take attention with the scenario in Brazil that is now facing with the 2 big epidemics, dengue and COVID-19, having both their peaks now, as demonstrated in the graphic, and have both present similar clinical and laboratory features, which makes the individual diagnosis very hard at the beginning. The healthcare system in Brazil is facing the risks of collapse. Diphthon vision is to create a better environment by minimizing mosquito diseases around the globe, and to make it possible, Diphthon application can provide enough information on the help the control of mosquito diseases and on the communication about risky areas. And how to make this? Next slide, please. Aedes mosquito are dependent on climate and environmental conditions. climate Earth observation data, biological data, demographical data, and the other relevant data are trained and tested in artificial intelligence and give us a prediction model for 4 weeks in advance for Aedes outbreaks. As an example, you can see here the risky area map from the Brazilian city of São Paulo with real data trained by Diptron artificial intelligence system. Next slide, please. Yes. Diptron application can offer to governmental and non-governmental organizations an early warning system for Aedes outbreaks, which allows decision makers take mitigation actions. As a result, they can save money by reducing the costs of campaign and remediation actions. Diptron Web Information Services provide all data about risky areas for advanced outbreaks, visualization of potential pesticides, and the access to the number of cases in specific areas. At present, Diptron e Visiona have been developed a pilot to the São José dos Campos city in Brazil. Next slide, please. So, which benefits can Earth observation satellites provide for Aedes mosquito outbreaks? They can provide accurate and timely information in wide areas, analyze potential breeding sites, can give early identification of epidemics, provide monitoring and environmental parameters updates, help to plan and support logistical emergency management, and allow to update the mathematical model. Besides the use of Earth observation satellite data in artificial intelligence system, Diptron can provide accurate and high resolution and reduce time and optimization of the costs. But the most important benefits that Diptron can offer is saving money by reducing the costs of a campaign and the remediation actions, and save lives by minimize lives and risk of a variety of diseases. Next slide, please. Thank you.
Perfect. And thank you. If we had more time, it would be fantastic to hear a little bit more about how you developed that artificial intelligence, which is obviously so key to such a crucial service. But unfortunately, in 7 minutes, we're limited in our exchange. But yeah, a fantastic example of exactly what we're looking for, which is space making all the difference. So thank you very much for joining us, and please do stay around because I'm sure there'll be plenty of questions at the end. So our next 7 minutes is coming from Mr. Alberto Fernandez-Wyttenbach, who's from the European GNSS Agency, GSA, which I'm going to assume means you're based in Prague, but who knows these days. And he's going to talk a little bit about how Galileo, the European program, is reducing the impact of COVID-19 with regards to the transportation across borders. So another really interesting angle, and we're very much looking forward to that. So please, over to you, Mr. Alberto Fernandez-Wyttenbach. Thank you.
Thank you, Ian. Thank you, everyone, for being here today. Cheers from Spain. I'm here with my family, but yes, we are based in Prague due to the situation. As you said, we are going to speak in this panel about how to reduce the consequence of the virus, not really to fight the virus in some cases. I will start with one of the applications we are developing. There are many others, but we will focus on this one because it's affecting mobility. Next slide, please. So as you know, the European Union is composed by 27 countries, and one of the main advantages is the free movement of people and goods along all our internal borders. But not anymore, because due to the pandemic, several member states have either closed the borders with other members or imposed new health screenings, controls, in order to further prevent the spread of the COVID-19. So, as you can imagine, this has created several kilometers of queuing in the border crossings, hours of waiting in them, and what is more important, the delay of the delivery of critical goods, such as medicine or protection supplies, that has to be distributed throughout all Europe. So, as a countermeasure, the European Commission decided to issue some guidelines in order to urge the countries to limit as much as possible the time needed to pass the crossings. And they impose a limit of 15 minutes. That is quite challenging to go through this border crossing, so-called green lanes. With this aim, our agency that is supporting the European Commission, as you know, in the e-Geos and the Galileo program, we decide to develop a solution, a mobile solution that is relying on satellite positioning in order to support the coordination between the member states, but also to bring information about the monitoring of the 187 border crossings that are identified as strategic crossings by the members. So these are the ones you can see in the map. We are developing this solution in partnership with a startup company. It's a European leader. It's called Sixfold, because we don't want to enter into the competitive market of navigation platform. But it's also our intention, our objective is to support European industry. So we expect this company also to continue after the crisis with this solution. We have two interfaces designed, one for the border control authorities and another one for the drivers. And then saying the drivers because it can be used by trucks or it can be used by cars. It's the possibility to distinguish as well. And it's available right now only in Android, this App Store, because we are in pilot testing, closing right now, but very soon we are going to have also a version for iOS. Next one, please. So the first one is the interface for border authorities. With this one, the officials, they can report on the situation from the borders, and they can also anticipate the traffic in case of peak time. We are simply asking them to help us updating the map with three categorization of the situation in 3 different colors. And they have the possibility not only to make pictures on the situation and share with the drivers, but also to send notifications. So if, for example, the country decide to prepare a separate lane for priority goods, this is the way they can notify to the drivers. We are successfully testing this since 2 weeks in Czech Republic and Hungary. And we got already 5,000 inputs from them, so it's quite a lot. And soon we are starting in Spain, in Greece, in France, and also in Romania. Next one, please. So there is the second interface is dedicated to the drivers. As I said, we are thinking on the trucks, on the transport companies, but it's also helping passenger cars as well. In this case, it's different because everything is working automatically. There is no need of manipulation because we are driving, of course, so it doesn't make sense. And more important, we are respecting privacy because we are not doing a tracking all the time of the device. We are tracking only when they are approaching to the borders. There is a geofence of few kilometers from the crossing, and when they enter into this fence, this virtual fence, is when the tracking starts and they start sending information to our servers. This information helps us a lot to validate the information from the officials, and during the testing we realized that there is sequencing of 70% due to the fact that the officials, they don't have visibility of how many kilometers of queue there might be, no? In only 2 weeks, we got more than 2,000 downloads, and this morning I received an update that we are already receiving information from 97 different border crossings, representing around 50% of the map I was showing at the beginning, and spread in 26 countries. Just to finalize, I would like to say that we are collaborating with the International Road Transport Union in order to organize webinars and also to create awareness into the truck drivers associations. And this is really, really helpful. Next one, please. So once we get all this information from the borders official, from the truck drivers, and also from information that is crowdsourced from other sources. For example, some countries, they have getting information from other devices. And that is the case, for example, of Czech Republic, that they use the satellite positioning tolling system of the road to get the information from the onboard units. And this is very useful as well to crowdsource in our application. So everything is crowdsourced in sixfold platform. And then this information is possible to be visualized in real time, and also it's possible to get some analytics. These analytics are, you have the link there, I don't want to spend time on this, but it's very useful because this can create reporting for the European Commission to understand the situation and how this, which are the crossings that are creating more troubles, and to react in case. Next one, please. So this was just an example. As I said at the beginning, I invite you to check out the catalog of different satellite navigation applications that are worldwide, not from us, of course, but worldwide developed in order to respond to the COVID-19. And thank you once again for the invitation, and hope to hear your question at the end. Thank you.
Thank you, Alberto. It's always a nice reminder to illustrate what the real power of space that's unlocked when the systems start integrating together, Earth observation, GNSS, and obviously SATCOM as well. So thanks for your presentation, very much appreciated. Okay, now we're moving over to Mr. Jason Hatton, who is the Science Coordinator for Biology and Environmental Monitoring Science at the European Space Agency. He's going to be talking a little bit about ESA's activities in support of global health. So Jason, over to you. Thanks.
Okay, thank you very much for the introduction. In fact, this is a two-part presentation. So I'll give an overview of ESA's activities in general, which support global health. And then halfway through, I'll hand over to Rita Ronaldo, who is the head of Institutional Project Section, Downstream Business Applications Department, who will talk about specific activities which are being done in response to COVID-19. Also, I'd like to acknowledge my colleague Anu Ranj, who coordinates many of the technology and application projects that you'll see identified in this presentation. So if we can go to the next slide, please. So European Space Agency is an intergovernmental organization with 22 member states and a number of cooperating states. The activities that ESA covers basically almost all of the areas of space activities, so space science, human space flight, Earth observation, launching into space technology, telecoms, etc. Now, many of these activities have either direct or indirect relevance to health. And what I'd like to do in the small amount of time we have available is give a couple of examples of those activity areas. So if we can go to the next slide, please. Okay, so we had quite a number of previous presentations which talked about Earth's observation data and products. And indeed, one thing which is very important when we talk about health is really health in a broader context. And in the Space and Global Health Working Group, one of the terms we often use is One Health. And so health is is affected by the environment. It also links to animal health, agriculture, etc. So Earth observation data products are very important for this. So ESA has developed a number, quite a large number of Earth observation satellite missions. And so these are basically three classes. There's the scientific missions, the Earth Explorers, so those are developed and operated through the ESA program. They basically are pushing the technology and the capabilities of Earth observation. And then there is the European Union funded Copernicus program. And so the Sentinel satellites have been developed to and those are then operated through the Copernicus program as a space segment. And then, of course, for the meteorological satellites, METOP, which are operated by EUMETSAT. So what I've done also with these slides, you notice I've highlighted the SDG targets and also the WHO focus areas in a general program of work that these activities relate to, and you see a very broad base. So Earth observation is very important for monitoring and implementation of sustainable development goals. So EO data is used in implementation of official development assistance projects, so providing environmental information for environmental safeguard, monitoring and evaluation. And also is very important for also measuring and monitoring implementation of the SDG targets. So this data is also used by UN statistical offices and national statistical offices. Now, in the previous presentations, there were some very nice examples of how Earth observation data is relevant to various health areas. And so some of the examples we've seen water mapping. So this can be accessibility to water. It can be accessibility to healthcare centers for instance, in areas where you have flooding, predicting what is the best way to access those healthcare facilities at different times of year. We also heard earlier studies on looking at disease vectors such as mosquitoes. So again, by mapping water bodies, you can identify where there's risk areas. Climate change is also very important for health. If we think of respiratory diseases, so monitoring aerosols, pollutants in the atmosphere, and also in disaster response, the International Disaster Charter is basically, and then with UN SPIDER as a mechanism to, in response to disasters and emergencies, respond to needs in a timely manner, rapid manner. So if I can go into the next slide, please. So another area is human spaceflight, and this is actually the area that I work in. So basically we have astronauts that go into space, and so we can study the processes which occur during spaceflight, and also analog platforms such as bed rest or isolation. Also gaining experience of working in the space environment. This is an isolated environment. How do you develop countermeasures for that? How do you support also the crew in terms of technology, etc., and so diagnostic technology. And so the areas are, for instance, with medical and biological research, when people go into space, it's an environment of extreme disuse. You have high bone and muscle loss unless you have some countermeasures such as exercise or other countermeasures, dietary supplements, etc. So this has also transfer of the knowledge from this research is relevant to terrestrial uses, such as how do you counteract the effects of sedentary population, or also health issues associated with aging. You also have other areas such as water treatment, recycling on board the station. That can be also transferred to terrestrial applications. The other thing is also in terms of medical care. The crew are isolated, and certainly once you go beyond low Earth orbit, they would also have to work autonomously. So again, the technologies you need and the approaches you need for that are very important. Also for populations which are isolated or having to work autonomously without external support or help. So autonomous decision making in terms of medical care. I mentioned briefly also the technology to support this. The other thing is also in terms of optimized use of physical exercise. I mentioned countermeasures against, say, bone and muscle loss. And of course, you can do lots of exercise to counteract that, but that's also very difficult in a normal working day. So also understanding what is small doses of exercise which can be beneficial, and how that can also be relevant then to the normal terrestrial population. So if I go into the next slide, please. So also one thing which is very important is technology. So this is technology for space applications, but also application of technology for space technology for terrestrial uses. And so one example is in the picture just there on the upper right-hand side. This is actually a grey water recycling system, which was used in the Concordia station in Antarctica. So this is basically an analog of a spaceflight environment of being very isolated. So this was for that station, about a dozen people recycling grey water, and that technology is then being scaled up, and you see at the bottom right-hand picture has actually been used for a university of, I think, 1,200 people in Morocco. So that shows a transfer of that technology with the initial intention for space application to terrestrial applications. At this point, I'd like to hand over to Rita Rinaldi, who will give an overview of applications of space technology for Earth and some of the activities which have been done for COVID-19. Thank you.
Yes, thank you. Thank you, Jason. So I'm happy to take it up from here. My name is Rita Rinaldi, and I'm working in the Business Application and Space Solution Group in ESA. And our mandate is to stimulate and facilitate the development of applications in a number of sectors. And of course, one of them is healthcare, but we cover a range of other sectors. So if we can go to the next slide, please. Yes, so for supporting industry in responding to the COVID-19 outbreak and supporting the development of applications to the benefits of citizens, we have established a number of initiatives. The first one was based on the cooperation with the Italian Minister for Technological Innovation and Digitization. You may know that Italy in Europe has been one of the first affected countries, and therefore it was felt very urgent by the Italian institutional stakeholders to take actions in order to face and respond to that emergency. So we have started a call for demonstration projects in the area of healthcare and education, and we had a huge response, amazing, from companies. More than 130 proposals were received from 16 member states, because the call was open to companies residing in any of the ESA member state wanted to propose the development of their concept, idea, and applications in these two sectors for the benefits of Italian user communities. We have also obtained the engagement of very renowned hospitals and healthcare institutions in Italy that are involved in these projects. Out of the proposals, 40 have been retained to the next phase, and actually tomorrow is the first deadline for them to propose the demonstration project. So we would possibly be able to support and fund quite an important number of activities in this respect. The second call was based on the requirements of the UK National Health System, NHS, and has also delivered a number of proposals responding to the specific needs during the pandemic, but also in the medium term for the healthcare system in the UK. We will have a third action open to, let's say, all companies to propose their ideas for application on the two topics to be showcased and piloted in any of the European countries. So if we go to the next slide. Yes, so I think I can mention that the proposals that we have received cover very broadly the topic of healthcare and education, and in particular around the healthcare side, they range from social care, so support also to elderly people, for instance, or vulnerable categories, support to medical operations, monitoring of the spread of the epidemics, and also support to security and emergency response, telemedicine activity, but also epidemiology, and support to the policymakers in order to plan resource and undertake actions also in terms of future lockdowns. you can find in the presentation a few links where this is explained more in detail. Of course, on our side, you see here a statement of our director that stresses and emphasizes the fact that these proposals, I think, have showcased through the projects that will be implemented, we plan to showcase the benefits that space, telecommunication, Earth observation, but also spin-off of technologies that have been experimented in flight before can bring to respond to this emergency. If we go to the next one, I would like to mention an example of a project that has been already demonstrated, that has been proven to be successful. It was demonstrated actually first to respond to other epidemics, and particularly on the occasion of the Ebola crisis in Africa. And the project is BeLife, which is a multi-mission and multi-user field communication and control system that is relying on satellite communication together with integrated with terrestrial communication, and provides a support to emergency response operators on the occasion of this type of epidemics. And the BeLife team has been requested and asked to provide support also on the occasion of the current pandemics by the president of the Piedmont region, the Piemonte region in Italy, which is one of the North Italian region most affected by this emergency. If we go to the next one, I would like to provide an outlook on the future, because I think space technologies are not only useful for now, but will also help on the path to the post-COVID recovery, as it was presented before by also the insight of PricewaterhouseCoopers on the flight radar data, which show a dramatic impact on the aviation sector, for instance, but also on the mobility sector. We think that there are a lot of ways in which space technology can help the society in the recovery and in the medium term. So we will launch the next month an ITT for feasibility studies open to companies to propose and develop their ideas that will apply in a number of sectors, including healthcare and public safety, but not limited to that, covering from the food sector, agriculture, mobility, transport, aviation, etc., to see how space can be useful under those conditions. This study will also leverage on the inputs on a number of partners, and one of them is, for example, on the topic of sanitation, the Toilet Board Coalition, which is a coalition of stakeholders engaged with smart sanitation, particularly for developing countries. And of course, this is one of the topics that are also very relevant in the context of the current emergency. But we are also engaging with a number of municipalities in Europe that are taking measures in terms of public safety, mobility, food supply chain for the next months. So if you have any interest in this, please drop an email or send a message, because we are very keen of engaging with the widest possible representation of institutions and stakeholders that could shape the needs for these activities to take place and to be relevant. Thank you.
Thank you, Jason, and thank you, Rita, for that. I mean, it's really good to see that institutions not perhaps normally thinking about space are reaching out and collaborating with the European Space Agency, and hopefully this, which I'm sure it will, this outreach will continue long into the future. So that's the final presentation from this second session. So we are now moving into a question and answer phase. So I'm keeping an eye out on the chat And I haven't seen any questions coming forward currently. So I'll just give a couple more moments in case there are any participants who've been waiting for us to come to an end to type anything in the chat which they would like to hear a little bit more from the panelists. Of course, the panelists, if you want to reach out to them, we're not in a position to share emails directly because of privacy. But if you do, feel free to use the chat or also reach out to the organizers, and we'll see if the panelists are available to be connected. So I am just seeing a little bit of here, and yeah, it's just basically questions about the presentations and lots of expressions of thanks. So of course, the presentations will be made online. All the presenters have already agreed for that to go onto the UNOOSA website, and we are being recorded, so the whole thing can be played back at your leisure. I don't see any questions, so feel free to ask. Oh, okay, here we go. One's just come in. So this is going to Jason and Rita at the ESA team. And, okay. I think I already know the answer to this question because, yeah, UNOOSA is watching closely and looking forward to experiencing this. But the question is there any plans for an online hackathon or on the latest call for interest by ESA regarding COVID-19 with regards to EO data? So I'll give that over to our ESA colleagues to see if they can come back to that. Thank you. So a bit of head scratching going on then. I'll just repeat one more time just in case.
Yeah. No
problem.
I can take this. Yes.
Okay,
No, at the moment for this let's say this coal plant, this future ITT plant on the path for post-COVID recovery, there are no plans to have an hackathon. But of course, I would be more than happy to relay your questions to the ESA colleagues of the Space Solutions that I'm sure are organizing this type of events, and therefore please reach out to me, and I will route you to the competent, let's say, people in ESA taking care of this.
Perfect. Thanks a lot, Rita. Really appreciate that, and that's all part of what we're trying to do here at the UN. It's getting that platform for these kind of links and connections across the network to take place. So really good to see that. And Rochelle is answering in the chat there with an expression of thanks. So great. One more question from Rashid, and this is talking about a potential link between weather in terms of climatology and COVID, based obviously on the fantastic contributions that space technologies make to the weather sector. So really the question is there an anticipated link coming between weather and COVID-19 that any of the panelists, and perhaps I'd like to throw this out to the speakers who were talking earlier, on this topic, and personally speaking, I haven't come across that, and I'm not aware of anything in that direction, but it's a great question from Rashid, so I'd like to open it to any panelists who would like to pick that one up if they so see fit.
Yeah. If I can have a start on this, I think from the proposals that we have seen, and particularly on the topic of epidemiology and on the planning of, let's say, possible future lockdowns, what we see is that, of course, there is an attempt to map also risks and vulnerability. And clearly air quality and weather condition are an important aspect to be taken into account in order to assess the population vulnerability to possible impacts of COVID-19.
Perfect. Thanks again for that, Rita. Anybody else from the rest of the panelists? It's an interesting one. Yeah. Okay. Not a problem at all. As I say, there'll be chances, hopefully, for connections to be made after the webinar. So if anybody has further questions or wants to get in touch with with the experts that we've heard from today, yeah, please feel free to do so. So I think, yeah, we're coming to the end of today's webinar, or I should say this morning's webinar. I do want to note that there is going to be a second webinar later on in the afternoon, at least here in Europe, with a slightly different set of speakers and different combination of speakers. Obviously, here at the UN, we try to be as global and as accessible as possible, which is why we chose two time slots to try and open up access to the largest audience out there. So as I say, this is being recorded and it will be available online. Colleagues from UNOOSA are also taking a brief summary of the discussion, and that will be also publicly available in due course, as will all of the slides that we've seen today. So I think the only thing that is left to do is really just to summarize briefly in terms of what we've discussed from the intergovernmental policy process right at the very start during the working group on global health from in the auspices of the Science and Technical Subcommittee of the Committee on the Peace, Research about Space. We've then gone through the different technical aspects of the work that we're doing here at UNOOSA, both in a general sense and also in a specific emergency response and disaster risk reduction sense as well. We've then gone to see how the power of space technology is being unlocked from a whole range of institutions, from private sector to public institutions as well, and how that's being picked up by policymakers to make sure that the decisions that they're making are as well informed and as efficient and perhaps most importantly as effective as possible, all on the back on the power of space. And I think we should probably end by going all the way back to the comments from the director, in that it really is partnerships and networks that is key. No one entity, no one individual, or no one group of individuals can truly unlock the positive potential that space and space technology and the data derived from that technology has for the benefit of humanity. So it really is going to be through working together in networks and in partnerships that we're going to get even close to reaching that goal. And I suppose on that note, I should say that today's two sessions are hopefully going to be the start of a series of events and activities which UNOOSA will be doing to really channel and highlight the role of space in response to COVID-19. And we very much hope that everybody who's joined us today will look forward to working with us in creating this network of partnerships that we're going to be needing to really tackle such an important issue. So with that, I'd like to draw a close and thank you once again for taking the time to join us. It was great to see such a large turnout and such a large turnout being maintained over the 2 hours, which is really, I think, a testament to the level and the quality of presentations from our expert panelists. So, and a special thanks to each and every one of you. So with that, I'd like to draw it to a close and wish you all a fantastic Thursday. And enjoy the rest of your day, and please do keep in touch. Thanks a lot.
Bye-bye. Thank you.
Thank you.
Thank you. Bye.